My name is Kathy Klein. I'm the research coordinator for the Division of Healthcare Communication at UBC, and I wanted to share some strategies that I use in developing relationships with community-based organizations for the work that we do. One strategy that's been particularly helpful is to identify key point people in the community organization who are responsible for outreach and education. And so when I identify those people, I like to cultivate a relationship with them, and that's usually best done in face-to-face meetings. Could be over coffee or going for lunch, that sort of thing, but so that they have a face and a name associated with the work. So that's one strategy. And then I also wanted to share a story about an experience I had in developing a relationship with an Aboriginal community to send our students to Aboriginal summer camps where they could learn about culture and developing appropriate relationships. And what I did is, because I didn't have a lot of experience with Aboriginal communities, is I looked for opportunities for reciprocity. And in the first year of the partnership, I was looking at a brochure for one of the camps, and I discovered that they were doing a blanketing ceremony. I didn't actually know what a blanketing ceremony was, but it seemed to me from the brochure that it was important. And the students were supposed to bring with them to the camps a new blanket for the ceremony. So I decided that I would go out and purchase some extra blankets to send out with the students. And it turned out that that was a really meaningful thing to do. One of the elders had commented in some follow-up research interviews that we did that was a really nice gesture that got the partnership off to a good start. So my advice is to look for opportunities to reciprocate that are meaningful to the community.
Well, my name is Paul Kirsten, and for the past 7 years I've been employed full-time at a community organization called Positive Living BC in downtown Vancouver, British Columbia. And community for me is a larger group of individuals than just those outside of academia or professional endeavors. Community is an interrelationship between people who are doing a variety of different functions, serving a greater purpose. So when I think of education and when I think of people in professional disciplines, I think the community needs to be involved. And I think one of the ways in which they're involved is in an education in the professional disciplines. I've seen this in practice with a course that I've had the fortune of being the co-lead on. And in that course, we bring together people who model interdisciplinarity from the points of view of medicine and nursing and pharmacy and social work, dietetics, and other disciplines as well. And I think it has also been a real lifesaver in the Health Mentors program, which is something that I'm very fond of and I've been involved with for several years now. And in the Health Mentors project, I bring a lens of a community working at Positive Living BC, also an individual living with a chronic health condition, and I watch as in each 2-hour session we see a person from medicine, a person from nursing, a person from kinesiology, and a person from occupational therapy learn how each other learns in their professional programs and how they relate to one another in service of a person. And I think what it ends up doing is it ends up showing how one person doesn't solve it all. A group of people solves it together, each of whom has a scope of practice, but interrelatedly, they help bring a solution to people's health.
Hi, my name is Sue McDonald, and I'm a community partner with the Division of Healthcare Communications at UBC. I'm involved with a number of patient projects, but the one that I'd like to talk about today is the Health Mentors program. It's dear to my heart because it's involving patients as educators, and I am very passionate about having people with lived experience of chronic health conditions feel empowered to be a driving force in their healthcare. The people that I work with often feel that they are a recipient of care, so they have a patient identity. Involvement in this type of program where they're part of the education gives them a chance to explore the power of their personal storytelling and how they can have influence on future healthcare professionals. The mentorship program is really an opportunity for a group of people to explore different topics, and the health mentor adds to the conversation, helps drive the conversation, and also has an opportunity to sort of assimilate what the students are experiencing in their programming. And I think it's an enriching opportunity all around. The people that I know who've been mentors have also had an opportunity to go back into their community and share what the experience is like. It's kind of infectious. I think the people who've had this opportunity to work with students are looking at their actual healthcare providers in a different light. I think they're also holding them to task. You know, it is empowering to know that the information you have about you as an individual is unique and an important part of the process. And in my work, it's just wonderful to see people get a chance to do that type of exploration and then be more passionate about their community in general. My work is around involving clients in care, and opportunities like this are unique and really give me an opportunity to show people possibility.
Hi, I'm Cheryl Hewitt. I work with PeerNet BC, a small not-for-profit that works with people mostly from marginalized communities to help them develop the skills they need to lead or participate effectively in peer support groups and any other kind of peer-led group. Part of our mandate is also to build awareness amongst health professionals around the value of peer support. So in the work that we have been doing with people from UBC around community involvement in health professional education, I find it helpful to look through the lens of the values of peer support as we're trying to identify some of the issues that we're going to have to address together to create more effective partnerships. The very first value of peer support is that there is a value to knowledge gained from experience. I think this means that we need to learn how to co-create the environment for student learning, to involve community in objective setting and evaluations, and to really explore both at the community level and the university level of what that value is to the knowledge that we bring from community. And flowing from that is the second value of peer support, which is reciprocity. There is a value to giving and there is a value to receiving. And there's a challenge when teachers need to become learners and when learners need to become teachers. And I think we also, in terms of reciprocity, need to clearly define what the benefit to community-based health professional education is, both to the university and to the community. The third principle is the principle of equality, that we need to come together as equals. And I think community can see very clearly in some cases how that power differential between the university and the privilege there plays out in community. And I think we have to build a common understanding of that. We have to learn how to address those imbalances, and we have to both to learn how to become each other's allies in this work. So I think those three principles of equality, reciprocity, and valuing knowledge gained from experience can really help us move together to create partnerships that are effective and sustainable.